In this video, we will talk about a very special painkiller, used during childbirth. It is called epidural analgesia. What is epidural analgesia? It involves administration of medication into epidural space, which is outside the membranes surrounding the spinal cord. Importance of epidural space. Epidural space contains blood vessels, nerve roots and fat. What is the location of epidural space? The epidural space exists between the dura mater and the ligamentum flavum, extending from the foramen magnum to the sacral hiatus. When to give epidural analgesia? In most cases, epidural is not given until the mother's cervix is at least 3 to 4 centimeters dilated, because it limits mobility, making it non-ideal for early stage of labor. When the cervix is fully dilated, most doctors consider it too late for epidural. When to end epidural analgesia? It should be continued till end of third stage, along with any perineal injury repair. Advantage of epidural analgesia. This analgesia shows differential block, that is, it preferentially blocks pain sensation. It has limited motor blockade. Indications for epidural analgesia. The main indication is for effective pain relief. What conditions are contraindicated for epidural? It is contraindicated in patients having following conditions: coagulation of disorders, localized sepsis of spine, systemic sepsis, hypovolemia, history of spine surgery, local deformity of spine, lack of trained staff. Time range of epidural analgesia. This procedure's setup takes about 20 minutes. Then, the drugs give effect in next 20 minutes, so it takes 40 to 45 minutes for analgesia through epidural route. Forms of epidural analgesia given during childbirth. It can be given throughout labor as intermittent boluses, continuous infusions, patient-controlled analgesia. Location of epidural analgesia. An epidural injection may be administered at any point of the spine, but most commonly the lumbar spine, to target the required dermatomes. Below the end of the spinal cord, normally inserted at L2 to L3, L3 to L4 or L4 to L5, intervertebral space. Layers pierced in epidural route. Epidural needle pierces through following layers: posteriorly to anteriorly. Skin, subcutaneous tissue, supraspinous ligament, interspinous ligaments, ligamentum flavum. Epidural analgesia set. It consists of 5 parts: epidural needle, also called TUI needle, LOR syringe, catheter connector, filter, bacterial filter, epidural catheter. Epidural analgesia doses. It is given in 2 steps. Test dose: 3 meters L of 1% lidocaine with epinephrine, in ratio of 1:200,000. Loading dose: one of the option consists of infusion of 0.0625 to 0.1% bupivacaine with fentanyl. Epidural precautions: mother should never lie supine, to prevent aortocaval compression. Hourly assessment through cold spray must be done, to check the level of sensory block, to prevent the risk of respiratory compromise. Treat the fallen BP through IV fluids and vasoconstrictors. Delay in labor due to epidural analgesia. Due to epidural analgesia, second stage of labor is prolonged, leading to greater chances of instrumental delivery. Complications of epidural analgesia: accidental dural puncture, spinal headache, bladder dysfunction, hypotension, accidental total spinal anesthesia, drug toxicity, short-term respiratory depression of baby.